What do all these people have in common, you ask? Well, they all have body dysmorphic disorder, otherwise known as BDD. BDD is an under-recognized yet relatively common and severe mental disorder that affects 2.4% of the general population and affects as many as 7 to 15% of people undergoing cosmetic surgery. Do you have negative body image? You may have BDD. People who live with BDD believe that they look ugly or deformed, when in reality, they look normal. Their behaviors usually surround the following: ritualistic behaviors aimed at confirming the defect or avoiding its recognition by others, needing constant reassurance from others, spending 3 to 8 hours daily on thoughts and behaviors related to this defect. These behaviors are extremely difficult to resist or control. And lastly, repeatedly seeking referrals with dermatologists or cosmetic surgeons to correct the defect. Most patients perform repetitive, compulsive behaviors aimed at examining, improving, or hiding the defect. Common behaviors include: to be diagnosed with BDD, the preoccupation with the defect has to cause clinically significant distress or impairment, and as a result of the appearance concerns, the person may stop working and socializing, become housebound, and even commit suicide. It has been reported that suicidal ideation has been found in 45 to 70% of those with BDD. What's even more shocking is that the suicide attempt rate is at 22 to 24%. Other characteristics include poor insight and delusions. Nearly half the people with BDD are delusional because they are completely certain that they look abnormal and that their view of the defect is accurate. Let's take our friend Morgan here as an example. She believes that the mole on her face takes up her whole cheek, when in fact it is very small and barely recognizable. She is so preoccupied by her weight that it is causing her significant distress and is impairing her social and occupational functioning. Furthermore, this exaggerated preoccupation is not better accounted for by another mental disorder, such as anorexia nervosa. A majority of people who live with body dysmorphic disorder have ideas or delusions of reference. They truly believe that others are taking special notice of this defect and are probably staring at it or talking about it or mocking it. As in Morgan's case, she totally believes that her classmates are staring at her, but as we can ascertain, they don't even notice her mole or her weight. It's not all bad news. The good news is that if you have BDD, it can be successfully treated. First, you can see your doctor to get a proper diagnosis. Your doctor is likely to take the time to hear what is going on and may recommend medications or refer you to a psychotherapist. There are many different medications that can help you manage body dysmorphic disorder. The most common are selective serotonin reuptake inhibitors, otherwise known as SSRIs. Seeing a therapist is also highly recommended. For BDD, the psychosocial treatment of choice is cognitive behavioral therapy, consisting of elements such as exposure, response prevention, behavioral experiments, and cognitive restructuring. The goal of this treatment is to reduce your negative thoughts about your appearance and the compulsive behaviors that fuel the disorder in the first place. As we can see, Morgan's counselor has suggested she keep a journal and write down the beliefs she has about herself. She then has to take the time and evaluate those beliefs and then challenge them. Morgan used to tell herself that she was so ugly and fat that no one would ever want to be her friend, especially because of the mole on her face. But after going through therapy, she's been able to challenge that irrational belief and see the mole as what it is. What if you don't think you have body dysmorphic disorder, but you find yourself thinking negatively about the way that you look? In reality, most of us have bad body days. They usually happen after finding a gray hair or noticing a bit of cellulite. In Canada, approximately 90% of women and girls are unhappy with the way that they look. Whether you are struggling with body image or embracing it, We encourage you to take these steps to increase your health and body image. First, ask yourself, how confident am I with my health? How well am I caring for my body? Whether happy or unhappy with your body, you shouldn't be complacent about your health behaviors. To start, ask your doctor about whether your health, not just your size, is optimal. Next, examine your belief about what defines beauty. Think about those that you find attractive. Are they grounded, poised, kind, or none of those things? Beauty comes in many different forms. So guard yourself against negative media messages that come from Hollywood and the entertainment media. Be aware of what your body can do. Try body-oriented exercises based on the practice of mindfulness. This leads you to stop thinking about your body and rather to live in it. For example, the next time you're walking down the street, experience how your body moves and feel the muscles contracting. You will find that you relate to your body in a whole new way. Look for mindful awareness classes or relaxation classes at a local mental health, yoga, or meditation center. Be present and live for today. A lot of people put their lives on hold until they are happy with the way that they look. Some will delay weddings, while others will delay vacations where bikinis or shorts are a must. Delaying living can be a severe detriment to your mental health and happiness. So go ahead. Live life no matter how you feel about your body. Doing so is an important step towards making a positive change. To feel extra good about your body, try to maintain good posture. Body posture not only gives a better impression to others, it also boosts your own self-esteem, thoughts, and confidence. Next up, exercise. The simple act of exercise, irrespective of intensity or outcome, can also boost your self-esteem. So how does this work? Through the power of the mind. It may be that we are exercising, which we know is good for you, which translates into our perception of increased well-being. Lastly, if you're having negative emotions or feelings regarding the way that you look or feel, talk to a friend, a doctor, or a counselor. Don't be afraid to share with someone that you trust about how you're feeling. An outside perspective can be enlightening, and the support can be encouraging.